Hey everyone, good morning. Welcome to day 4 of the Weiner Wellness Week Fall Fiesta. We have Dr. Gideon Orbach with us here. He's back. I think it was you. You said we might get sick of you at some point during this week, but I don't think we've hit that point yet. You've been on quite a few, doing the morning commentary, doing the roundtable, and doing more lectures and presentations. So we always appreciate your expertise in
Thank
these
you.
areas. Today you have a great topic. Tips for a better workstation and body efficiency. So working from home, which a lot of people are doing. As you can see, I'm here now in my office at home, so maybe I'll be changing some things up, sitting a little straighter here, but I know you'll have some good tips for us today, so we're excited. So welcome.
Thank you. Thank you. Well, thanks for the warm introduction. My name is Gideon Orbach, and as I mentioned on some of the previous talks, I've been practicing chiropractic for the middle of November is going to be 19 years for me. In the middle of September, I had my 13-year anniversary at the Weiner Wellness Center, and this is actually our third virtual open house party sale wellness week. So it still hasn't sunk in on me that I'm not sitting here talking to a crowd of people and interacting and seeing everybody's smiling face besides Candace's. So we'll roll with it. This is something we just have to do to adapt to the very interesting and confusing times that we're living in. And one of the things that happened, as I'm sure many of the people who are listening in, and Candace, you know, is we've all been sent home to work. So it becomes incumbent on us to set up our own workstations and create an environment of productivity that we can be comfortable in. And we know we're responsible for our production, but at the same time, we have to make sure we're still taking care of ourselves. So I was on the Saturday KDKA show with Rob Pratt several months ago, and we got a call where somebody's question was they were asking for tips for how they can be more comfortable or set up a better workstation at home, which was really what a great question that was, and that was the genesis for this particular workshop. So I hope that the person who asked that question is actually looking in and maybe even feels a little patted on the back because their simple conversation thread leads to a workshop. So anyhow, as usual, I like this to be as much of a conversation as possible and less of a lecture. So if people have questions, go ahead and type them in. If you have anything you want to share on your Facebook feed, Candace does a great job of slowing me down and saying we have a question or a comment or even an outrage or a concern, and I'll stop at a couple points along the way just to ask her if anybody's weighing in. So anyhow, ergonomics is the study of efficiency in a working environment. So when we're at work, I know that if you go to your job and you're physically present on location, that you have a workstation set up, whether you're working with machinery or whether you're working at a computer desk, and somebody's probably set that up to maximize efficiency. And there's been a study, but now that we're all at home, we got to take care of this ourselves, and we got to figure about how are we going to maintain our good posture, how are we going to be able to work and schedule our breaks, how are we going to have control over our environment, and how are we going to make this all happen. So the first thing we want to talk about, as always, is good posture and good breathing mechanics. In all my talks, I always make sure that we set aside some time and we just do a few deep breaths together and make sure that people know how to breathe from their diaphragm and not just from what these muscles are called, the accessory muscles of respiration at the bottom of your neck and the top of your torso, the top of your chest. These guys act as a pulley system to lift your rib cage up and to set it back down as you breathe. The diaphragm, in contrast, is used as a pump to get the whole lung field, the whole torso to expand and compress and to maximize our ability to breathe deeply. So this is so critically important. And if you see little kids at the pool in the summer if we're allowed to go to the pool in the summer. You see the way they breathe so deeply and their whole bodies move with every inhale and move with every exhale. And then at some point we reach a transition point, and very few adults are actually good deep breathers. So let's before anything else, and before we talk about chairs and ways to enhance your light source and little tips and tricks, let's just work on a few deep breaths. So what I want everybody to do is to sit up as straight and tall as possible. And what we're going to focus on is our abdomen and our diaphragm acting as a pump. And we want to get these muscles, these accessory muscles that are all hiding behind my tie and my collar, to relax as much as possible and really not be involved. So we're going to inhale through our nose. And what we're going to do is we're going to think of our torso as being a giant balloon. So we're inhaling through our noses and we're expanding our chest cavities and we're sucking in as much delicious oxygen as possible. And our abdomens are going to get big as we inflate. And we're going to hold this for 1,001, 1,002, 1,003, and we're going to relax by blowing out through our mouths. All right, let's do that again. Big inhale through your nose. Torso is expanding. We're blowing up our balloons. We're holding it. 1,001, 1,002, 3, and relax by blowing out and letting your body sink back down to its natural position. Let's do one more and then let's talk about this. 1, big deep breath in through your nose. Everything is expanding. Your chest and your abdomen is coming out towards me and forward, and we're holding it. 1,001, 2, 3, and relax by blowing out through your mouths. Now, hopefully, all of you who indulged me and practiced this deep breathing technique with me are feeling maybe not necessarily lightheaded, but certainly an energetic shift, and your body should feel a little bit lighter, maybe a little bit more relaxed, maybe a little bit more efficient. Candace, if there are any comments on the screen, please let me know. Just chime right in. And if you were listening or if you were here for my talk earlier, a presentation earlier in the week on chiropractic and rehab and neurology, we framed the importance of deep breathing and talked about how we're feeding critical centers of the brain, which are very much more oxygen dependent than the rest of the body. We talked about how these accessory muscles of respiration, they become tight and they pull asymmetrically with the musculature in the back of the neck. And that's really the cause for many people's headaches to begin. And we talked about how getting deep breaths into your body will stimulate your cerebellum, that's part of your brain, to inhibit or to calm down the sympathetic nervous system, our fight or flight mechanisms, and allow our rest and digest, our wine and dine parasympathetic nervous system to go on track. Then the other day in another workshop that we shared, we talked about meditation and ways to just calm your brain down and be in better control of your own emotions and be in better control of your own thoughts and relax your body systemically. And really, the key ingredient to being a good meditator is breath control. So when we talk about how important breathing is, this is how sick people become healthy. This is how weak people become strong. We take deep breaths to get as much of the oxygen in, using our body as a breathing machine in an efficient manner. And that becomes so critically important while we're sitting at our workstations, trying to be efficient in the space that we have. So far, so good, Candace? Good. So tip number 1, while we're sitting here working, we want to focus on our big deep breathing mechanisms. And I'd like to try something so that everybody can see how significant this is. Because we're all working at our desks and at our computers, our tendency is to lean a little bit further forward into the keyboard and into the monitor to be able to maybe see what we're doing. And this starts to distort and disrupt our posture as I'm leaning forward. And if I turn to the profile, I don't want to come off screen. Can you see me? I hope. We lean forward like I'm leaning into my work. That's the very posture that we want to avoid. So what I'd like everybody to do, just to further emphasize how important posture is systemically, let's all lean forward into our computer and take that same deep breath. Inhale through your nose. And you should find that even if your chest cavity is capable of expanding in this position, your breath is only a fraction as deep as it was when we were back here sitting up straight. Okay, so the next tip that we want to talk about in terms of what we're doing at our workstations is consider your privacy. Is there anybody else who might be using your desk? Is there anybody else who might open your files or use your computers? That really depends on who you live with and the rules of your household and whatever privacy issues you might have. But on one hand, it's important that you remember where you store things, because privacy is privacy. You don't want anybody else disrupting your work. But also, you want to make a note of how high did you set your chair? Where did you, if you're working on a laptop, did you prop it up on anything, or is it sitting on the desk? And if so, how far away from you is it? Because other people will move your equipment and your machinery and readjust your chair and readjust the heights and any kind of foot support device that you might have, a wrist support device, which we'll talk about shortly, and to accommodate them. And then you're left wondering, well, how did my workstation become so uncomfortable? So when I talk about privacy, talk about hiding your files, but I'm also talking about your personal creature comforts. The second thing we should talk about is a light source. The windows and the natural light, those are your friends. Obviously, we don't want to work in the dark, and not all rooms and all areas have good light sources. So we bring in lamps and overhead lights. And because I can see myself on the screen, I know you guys can't see this, but I'm benefiting from it tremendously. And that is off to my right, propped up on the other side of the room. I have a pretty high powered flashlight. That flashlight is illuminating me so I don't appear to be so dark on the screen, and it's enabling me to see my notes on my desk. So with the flashlight being so far away off to the side, it casts a wide beam by the time it gets to me and by the time I'm being illuminated. And at the same time, there's no glare on me and there's no glare on the computer screen, which could be potentially disrupting or distracting. It could cause a different kind of eye strain that I don't want to acquire. So my light source is really good. My light source is out of the way, and yet it's illuminating my whole person. Okay, we got to talk about the chair. Ergonomic chairs are expensive. If your company will pay for you to get a fancy ergonomic chair, then good luck with that and have at it, and congratulations. I wish my company would. If you think that it's a really important creature comfort and you want to spend money to get yourself a good chair, I'm all for it. But there are ways of taking an existing desk chair and turning it into a really great customized, perfectly good ergonomic chair specific for you. If you go to AutoZone or a place like that, I remember in the early 1990s learning how to drive, having beaded seat cushions in my car. I miss my beaded seat cushions. I don't miss the car I was driving then, but I miss those beaded seat cushions. They were so super comfortable to sit on. So why not go to an auto supply place, find a cushioning that is particularly good for you. You have a number to choose from. Take them over to the waiting room, pick out the one that has the best lumbar support, the best lower back support, specific to your own personal needs and the contours of your own specific body. And that's the one for you. So we can take any desk chair and turn it into a high-end chair by using a back support or a cushion or a lumbar support that we would find at a place like AutoZone, or even Walmart or Target will have them as well. Second thing we want to talk about now is we don't want to be tripping over our electrical wires and our cables. So it would be a smart thing to recognize where your sources of electricity are coming from, where are the outlets, how can I get multi-port outlet or a multi-ports conductor and plug it into the wall. And then I can plug all my cords and all my cables into one source, and I can walk around my room knowing that I'm not going to trip over any cables or pull them out. Remember, we're talking about our own personal workspace in our own personal workroom, but you have to have complete control of it and make it a comfortable place. And we want to have a little bit of room to stand and do a few of the exercises that we're going to get into in a few minutes. Another thing that actually some of my patients were telling me that they were doing, which I think is a really bad idea, and they're doing their work on laptops from their beds and from their couches. Bed's probably more comfortable than the desk, but you're going to end up, one, with a lot of distractions. Two, you're going to start associating the bed as a place where I work, not a place where I sleep. And this turns people into bad sleepers, and they have more restless nights. And I talked about this with a couple of my patients in specific who told me what they were doing. And they were kind of surprised by the link, because they knew they were better sleepers in the past. They started working in their bed, and they couldn't make the connection that they turned their bed into a workspace, not a rest space. And they were had a psychological block, or they had some sort of a crutch that they were just unable to sleep in bed anymore. And I can say the same thing about working on the couch. Probably a much more comfortable place than sitting at a desk. Nonetheless, your couch is for relaxation and comfort and for company. So it's really very important for the ergonomic studies that have been done that say that people should have a very specific, whether you're going to the office or whether you're going to the office at home or whether you have a home office, it's very important that you have that one specific designated place where the production and the work is accomplished and achieved. Okay, the next thing I want to emphasize is how important it is to decorate. This is your workplace. This is where you're going to spend however many hours you're going to spend during the day. Customize it for yourself, not just for your comfort, but for your own aesthetic. Some people like to just be in a bland one color workplace. Some people like to have their own pictures or posters or souvenirs from trips or places that they've been or events that they've participated in. It's okay. It might make you feel better about being in your space and recreating an environment where you can be comfortable and productive and work as you once did in your on location office. So don't be shy to move some of your personal treasures around out of the living room or out of your bedroom and put them in your home office space. Okay, questions so far, Candace? Good. So let's do a couple more deep breaths. First of all, I want everybody to sit up as we did. We saw how by leaning forward, it was so difficult to take a deep breath. So we're going to sit in that contrived, beautiful chiropractic posture. We're going to inhale through our noses. Our torsos are becoming big. Our lungs are filling up like balloons. Our chests are coming out. Our abdomens are coming out. And we're inhaling, and we're going to hold 1,001, 1,002, 1,003, and blow out through your mouths. Let's do that again. Big deep breath in through your nose. We're on an expanded torso. Everything's blown up like a balloon. And we're going to hold it for 1,001, 1,002, 1,003, and blow out through your mouths. Now, let's adjust our posture with a different visual, something to think about. What I want everybody to do is to imagine the spot on their body where their belt buckle would live. So if you're wearing a belt, it would be just a few inches below your belly button in the midline. And then we're going to think about the spot where your chest ends and your abdomen begins, in that really tender piece of cartilage called the xiphoid process, the solar plexus at the bottom of the sternum. So we want to think about being as tall or as long as possible in that region of the body. So we're going to think about our posture as lengthening right in here. And when we do that, we're going to lift our chest cavities just a little bit up. So we're putting our chest up and we're throwing our shoulder blades back and down. So now we're sitting in much better posture with this cue from the abdomen. So you should feel a little bit awkward sitting in this place if you're unused to it. But you'd also feel your body sinking in. And what's happening is, as you're stretching your abdomen and you're lifting from your belt buckle to your sternum, one of the things that's happening is your transversus abdominis muscle is getting involved in holding the weight of your upper body. The transversus abdominis muscle is one of the muscles that make up the group that we would call our core. So as we sit here with good posture, emphasis coming from the abdomen, we're actually doing core stabilization and core exercises. Not to be confused with doing yoga or Tai Chi or getting to the gym or doing planks, but as long as we're sitting here doing our work, we can multitask and get our cores activated. And once again, at the same time, your shoulders should feel like they've lifted up, moved back, and then sank right down into a comfortable, natural, well-aligned, retracted place. So I know all week long we've had some great presentations about nutrition and specific products and nutrition in general, and ways to support your immune system and ways to support all your other body systems, in fact. But I just want to remind everybody listening in that this is also a chiropractic clinic, and we do a lot of hands-on treatment to help support people who are challenged with musculoskeletal and neuromusculoskeletal aches and pains, physical discomfort, headaches. I hope you can't hear the room next door to me, but Adam Carwa, our muscle therapist, is doing a session with someone even as we speak, right through our very walls over here. And that's the big bulk of what goes on here over the course of the day. And I talk about posture, especially workplace posture and sitting posture, with so many of my patients, that we talk to people who have sacroiliac pain and discomfort. The sacroiliac is the joint at the very, very bottom of your spine. You have your sacrum, and the sacrum articulates, or it forms joints or has movement patterns with the pelvis. So the sacroiliac joint is as low as it gets in the context of what can be lower back pain. So many people have one-sided sacroiliac physical dysfunction, leading to pain, leading to, they've been diagnosed with sciatica. And what happens is they sit in such a way that they're slouching to one side or the other, and they're literally compressing those joints under the weight of their upper bodies, under the weight of their torso, rather than putting that weight onto the core musculature. So once again, we're going to make ourselves as tall as possible from the bottom of our sternums to the top of our belt buckles, and we're literally stretching ourselves upwards. And if you get yourself upward high enough, you should almost feel a little bit of an arch forming in your lower back, and you could certainly feel your shoulder blades sinking down and into a very comfortable position. So once again, as long as we're talking about stability and comfort, I've never been to Europe, but I sure have watched a lot of Discovery Channel and a lot of Travel Channel. And one of the things that is always highlighted when it comes up is the contrast between Greek ruins and Roman arches. Thousands of years later, those beautiful Greek columns are crumbling down, but the Roman arches survive time. An arch is the most stable, strongest architecturally known configuration. So if you look at the spine from a profile, it's a series of arches. It's a convex curve sitting on top of a concave curve on top of a convexity, and so forth. Why is that? Well, first of all, for the creation of stability. Second of all, we have shock absorption. So if you have an arch on top of an arch, it acts as a better shock absorber than a column. So if we're sitting in this posture where we've gotten our torso to be really long through the abdomen, bringing our shoulders back, and an arch in our lower back, you should learn how to sit in that position. And like I said, it's going to be awkward at first, but once you get used to it, you should be able to sit here for a long period of time without a disruption, with your body feeling like it's stabilizing itself and your muscles move and support themselves, and you're not just propping your body up using anatomical parts that aren't designed to be supportive to act as the supports. So far, so good, Candace? Okay, now, as I sit here and talk about all the sitting and how to sit properly, we still know that when you sit, you're putting 40 to 90% more pressure on your discs than you do when you're standing. So if you have the option for a standing workstation or a sit-stand desk, that would certainly be the way to go. If you don't, that's okay. What we want to make sure that we're doing is we're sitting a little bit further backwards into our chair rather than a little bit further forwards. So if I'm sitting up straight and I have a 90-degree angle between my torso and my thighs, let's define that as 90 degrees and sitting up straight. Ideally, I'm going to lean back. So I'm going to be somewhere between the 90 and the 105 degree range. And what those 15 degrees are going to do is they're going to take pressure off of my discs in the front. I certainly don't want to lean forward to bring myself into that 75 to 90 range. And everything that we've talked about so far in terms of the posture being triggered by the abdomen, in terms of keeping your head up rather than leaning forward, is geared towards how are we going to keep our bodies in that 90 to 105 range as comfortably as possible for as long as possible. All right, let's take a couple more deep breaths and move on to the next exercise and then talk about computer setups. So sitting up straight and tall, we're going to take a big deep breath in through our noses. Chest cavity expands. It's getting bigger, like our balloons are inflating. And we're going to blow out through our mouths. Another one, big deep breath in through your nose. And hold some more, and hold again, and blow out through your mouths. One more time, big deep breath in through our nose. We're turning down our sympathetic nervous system. We're getting out of a fight or flight anxiety mode. We're turning up our parasympathetic nervous system, and we're going to be in a restful state, and we're going to blow out through our mouths. Very good. Now, I believe we've taken a break from the content on 3 different occasions in order to take 3 deep breaths per occasion. Didn't really take a lot of time. Still have plenty of time left to get through the rest of the content. The deep breathing is so important. Over the course of an hour working at your desk, I would suggest to everybody, do that same thing. Take those at least 3 different occasions over the course of the hour. You take 3 deep breaths, get back to work. A cycle later, take another 3 deep breaths in the fashion that we're talking about. And very slowly but surely, this is going to become automatic for you. You're not going to have to take a deep breath to concentrate and train your body to become a diaphragmatic breather. That's just how it's going to be. That's what you're going to turn yourself into. Okay, let's do something else. We can't let our necks get stiff while we're sitting here doing our work either. So what I'm going to do is I'm going to take my right hand and I'm going to put it just slightly above my left ear. So I'm really reaching around my head, and I'm going to give myself a little pull to the right, not to the point where I strain myself, but just to the point where I feel like I'm stretching the muscles and I'm working from 2 places. I'm bending my head and I'm pulling. So this is as much flexibility from an external source as just movement. So I'm just giving myself a very gentle stretch, and I'm going to hold it here for 1,001, 1,002, 1,003, just like the amount of time that I'm going to hold my breath in my lungs for. And then I'm going to do the exact same thing on the other side. I'm spreading my fingers wide. My hand is as big as I can. I'm getting it just above my ear. And I'm going to give my head a gentle pull to the other side. I'm going to go 1, 2, 3, and relax. So we're doing a little bit of allowing the muscles to move on their own in our necks, and a little bit of allowing an external source, that hand and arm, to pull along with synergistically with those muscles for just a few more degrees of motion, while at the same time, we're certainly not straining ourselves. So if you're pulling so far that it hurts, you're going too far. So we're going to pull to our side once again, just to the point where I feel a nice, easy, gentle stretch. And then I'm going to do the same thing on the other side. 1, 2, 3, and relax. We good so far, Candace? Excellent. Now, what we're going to do is we're going to keep our, if you could imagine a railroad track coming out of your chin, and our railroad track is parallel to the ground. So we're not looking up, we're not looking down. We're just sitting here straight and forward. And what I'm going to do is I'm going to bring my head backwards along my railroad track. Think about the train going in reverse. And I'm going to retract my head and neck to the point where I have a double, maybe even a triple chin. I'm going to hold it here, 1,001, 1,002, and relax. Let's do that one more time, all the way back. 1,001, 1,002, 1,003, and relax. Okay. So we want to, like I said, we want to avoid getting stiff. We want to keep our bodies as flexible and as comfortable as possible. And especially we want to have these mini exercise breaks at our workstation that never take more than a few seconds at a time, but allow us to get our blood flowing and engage the way our brains and our bodies are talking to each other a little bit differently in the middle of our workday. Okay, so we're here sitting at our desk doing some work. How do we know that our chair is right for us? Our feet should be able to be flat on the ground. So with our feet flat on the ground, if this is my foot, I want to make sure that I have 90 degrees at my ankle. So my toes are going to be facing forward at 12 o'clock, and my shin bone, my tibia, is going to be straight up and down, with my my foot and my tibia bone forming a 90-degree angle. Then from there, I want my tibia bone and my thigh, my femur bone, where my knee happens, I want that to be another 90-degree angle. So that's going to be a gauge as to what the right height for our chair should be. Feet flat on the ground, 90 degrees at the ankle, 90 degrees at the knee. And then we're going to move to the end of the femur bone of the thigh to the torso. And we talked about that torso being straight up. So there's our next 90 degrees. Now you might find that your legs are very long and you put your feet flat on the ground and your thighs are scraping the bottom of your desk. Well, then can we lower the chair? Can we raise the desk? You can put blocks underneath your desk to lift it. You can put the lowering and raising mechanisms of the chair. Or if your chair is static, you can put blocks underneath your chair to raise it if need be. We talked about having the driver's seat cushion from AutoZone as part of your chair to help reinforce the lumbar support, or to have an extra padding to sit on to make it more comfortable. So we're going to manipulate all of those variables. And as I said, if need be, raising or lowering the chair, raising or lowering the desk in order to suit your body. The next place we're going to worry about having the 90 degrees as at our elbows and wrists. So if I'm typing, I want my elbows to be the bones of my forearm, the radius and the ulna. They're going to form a 90 degree with my humerus bone. So I'm here, and I'm going to raise or lower my keyboard so my wrists can sit comfortably as I'm typing, arms at 90 degrees, elbows tucked into my body, so I'm not flaring out like so. Once again, we see a lot of people who they have hand and wrist pain, they have elbow pain. Some of them have been diagnosed with carpal tunnel syndrome, in my opinion, inaccurately diagnosed. But they develop severe muscle tension and joint restrictions, and what I would term as a chiropractic injury in their necks, the top of their rib cages, the top of the way their upper arms interface and articulate with the shoulder blades, at their elbows and their wrists, even down to the fingers, with specific muscles in between and that pathway involved, because they're spending so much time typing at a position, or they're working at the keyboard in a position that's just physically awkward for their own body. So let's nip that in the bud and make sure that we're all very well aware that even without a chair that might cost thousands of dollars, you can put that that driver's seat, the driver's seat padding from the auto shop on. You can raise and lower the chair. You can use bricks for the desk or for the chair. You can manipulate your own personal space very easily this way. The next thing we want to think about are our wrists. If you can get a specific type of foam pad or even a small pillow to have your wrists resting on as your fingers type, go for it. We want to have this position. We have the 90 degrees at our elbow, and then we want to have our wrists as flat as possible, even cocked up ever so slightly, but we certainly don't want to be typing down this way. So once again, more cheap equipment can prop our wrists up, and we'll be sitting in advantageous posture while we're doing our work. The monitor itself should be at eye level. So if you work on a laptop, you might think about propping your laptop up and getting an external keyboard. If you work at a desktop, prop your monitor up on a small shelf, a stack of books, a small box, and you're going to be golden in terms of having your monitor right there at eye level, so you never feel like you have to have your head coming out of good biomechanical posture, good ergonomic posture in order to accommodate yourself to the equipment. You make the equipment accommodate to you. Candace, questions? Are we good so far? Can I keep rolling? Excellent. All right, so we talked about the deep breathing exercise. We talked about stretching our head and our neck in each respective direction. We talked about retracting our heads to bring it further back. Let's talk about our feet for a second. We certainly don't want our feet to be too still for too long. When we think about all that blood that has to reach all the way down to our toes and then be pumped back up to return to the heart and lungs to be recirculated throughout the body, we got to activate the pumps that are in our calves in order to be circulatory aids. So let's do this as an exercise. I want everybody to sit their feet flat on the floor facing 12 o'clock. It's very important that the feet are facing forward, and I'm going to use my hands to illustrate. We're not letting one foot deviate out like so or either direction. We're literally conscious that we're facing forward with both feet. The reason for this, the reason these mechanics are so important, there are 28 bones in each foot. 26 of them are movable. We talked about that arch in the lower back that's formed with good posture as your abdomen comes up and you sit back into your pelvis, and your lower back forms a shock absorption arch. Your foot has 3 arches in it. I see a number of patients who have lower body complaints, foot pain, sprained ankles, Morton's neuromas, plantar fasciitis is a big one, heel spurs. We see a foot pain, foot discomfort patient, at least one every single day. And invariably, one of the patients will say, well, my arches fell, or I have very flat feet. That might be so. But first of all, there are 3 arches in each foot, and we got to address all of them, because what one does, the other 2 do. So there's going to be that fairly pronounced arch that is on the big toe side of the foot. It's called the medial longitudinal arch. And because it's the biggest one, it's the one that we're trained to think about. When my patients say my arch fell, that's the one that they're pointing to and say that that's where their foot is flat. On the outside part of the foot, there's another arch called the lateral longitudinal arch, which is just as important but less visible. And then underneath the toes, there's the medial longitudinal arch. So anyhow, I'm sorry, I said that backwards. Underneath the toes, we have the transverse arch. The medial longitudinal arch is the big one on the big toe side. So what these arches do is they compress and expand. And just as the Roman arches have stood the test of time, and just as we want to emphasize that arch in our lumbar spine to be a good shock absorber and a good stabilizing force, we want to make sure the arches in our foot do the same thing. So if you're keeping your feet at 12 o'clock for the sake of this exercise, you're going to compress and expand the arches, all 3 arches, the way they're designed to. If you let your foot deviate or roll out to one side or the other, you're going to shortchange your arches, and you're going to be literally exercising and training your body to make a mistake. So what we're going to do is we're going to put our right foot down all the way on our tiptoes, getting our heel as high up as possible off the ground. And then we're going to get our left heel dug into the ground, getting our toes up as high as possible. So we're really going to emphasize this position. And now we're going to switch. And then we're going to switch again. And think about all the joint spaces and all of those 26 movable bones in your feet really being stretched to their maximum capability. Think about the foot almost being wrung out like a dish towel in order to behave as a shock absorber. Can't promise you that this is the fix for all sprained ankles and all plantar fasciitis injuries, but it's certainly one of the exercises on the checklist that we assign to all of these foot pain patients. And we talk about the way the brain and the body communicate with one another in one of the previous workshops earlier this week. We're challenging our body to do coordinated movements, to work as a tandem from side to side. And this is becoming very much a neurological cerebellar exercise. So if we're talking about it from a rehab exercise, that's what's going on. If we're talking about it from a work at home and take care of your body at your own workstation, at your own pace perspective, we're getting more circulation into your feet. We're getting the blood to flow. We're challenging those very small diameter nerves and those very small diameter blood vessels all the way at the end of the chain to stretch and to fill up with impulse and to fill up with blood and to transmit information back to higher centers of the body. And we're not going to let blood become stagnant at the bottom of the chain. So once again, deep breathing, 3 deep breaths. Stretch your head side to side every hour. Bring your chin and your head back on this retraction. Work the foot drill. These are all exercises that we're going to do a couple more, but these are all exercises that none in and of themselves should even take you a full minute at a time to do, but will all pay enormous dividends in terms of keeping your body pliable, flexible, neurologically involved with itself and aware over the course of your day at your workstation. So let's do a couple more. First of all, when we're sitting in this posture where our belt buckle and our Our sternum, the bottom of our sternum, our solar plexus are very long and we're spaced out in there. You should feel your shoulder blades and your back, your wing bones sinking down and backwards. So let's reinforce that. I want you to think about your shoulder blades. And if you had long hair or a ponytail hanging down in the back, I want you to capture your ponytail between your shoulder blades, and you're going to squeeze as tight as possible, almost to the point where it's painful. And you should feel your chest stretching across the front. You should feel your body opening up in your torso so that you're capable of taking a deeper breath. And we're just going to hold this for those same 3 seconds that we've been doing everything else for, and relax. Let's do that again. Squeeze your shoulder blades as far behind your back and as hard as you can to the point where it's just short of becoming painfully tight. We're going to hold that 1001, 1002, 1003, and relax. One last time. Big squeeze behind our backs, holding it 1001, 1002, 1003, and relax. So far, so good?
Yeah, this has been really good. And what I really enjoyed is the setup, the workspace setup. I know before I've had reams of paper stacked up under my laptop, but then it sets my screen up higher, so I'm looking better, but then my wrists are not flat. So you mentioned that foam piece below the keyboard. These are a lot of things that I would incorporate more if I worked at home on a regular basis, but this is kind of just a temporary thing for me. But like you said, decorating your office. I had a dresser in here before that made it look like my bedroom. I got rid of that and I hung up a little poster and put a chair behind me that has a really comfortable pillow that sometimes I'll put behind me to get me to sit up a little bit straighter. And some of those things that really help to make a difference. And when I'm at the office, what I have are 2 monitors so I could see, but now as I'm here, I'm looking down at paper. It's all over the place. I work better on 2 screens. So that's something else. I pulled up my personal laptop to work back and forth on things. But it's not the same as being in my normal workspace. So like I said, I'm just here for the week. When we do these, I never work from home, but for people who have been shifted to home or don't know when they're going back, if you haven't made changes yet, it's been long enough, and those changes really need to be implemented. I had a different type of door on here. I got a brand new door the beginning of last wellness week, because you need to have your settings, not only for physical benefits, but for the stress and all of that, like you mentioned, working from your bed or your couch. That makes a big difference in your mentality as well, which we've all been affected enough in that area.
Well, yeah, you bring up important points that we understand that there's certain biomechanical principles that we have to employ in order to keep our bodies as efficient as possible and to prevent having repetitive motion and workplace injuries at a desk. But at the same time, you can manipulate so many of the variables. You can't change your body, but you can certainly change the height of the monitor or the height of the desk or the chair, or you can boost yourself up higher or even lower to suit you're not locked into one place. That's important, and I'm glad that you're taking advantage of those principles. So let's do another shoulder. This is once again all exercises that can be done at home in your workstation. If you get up and walk around your home office, which is probably a small room, but still enough room to walk around. Let's take our right elbow and put it in our left back pocket. So what we're going to do is point our elbow as far back as possible. Then we're going to rotate it down like we're going to throw a shot put. And then I'm going to tuck it into my body. So I'm going to get the point of my elbow as close to my left back pocket as possible. And I should feel a stretch right in here along the outside part of my chest, even the front of my shoulder, and all of those muscles that become tight When I'm leaning into my keyboard, we're going to reverse that torque. If I'm picking my arms up because I'm working on a laptop and I had to pick myself up higher, I'm going to get tight somewhere. So we're going to reverse the tightness here in the chest. Once again, putting ourselves in position where we can become more efficient, deeper breathers. I'm going to bring my left arm all the way, elbow all the way back, all the way down, and then across behind my back. So I'm trying to get my left elbow into my right back pocket, feeling the stretch right in here like so. 1, 2, 3, and relax. Let's do that one more time for each side. I'm bringing my elbow backwards, down, and across and in behind my back. Here's my stretch. 1, 2, 3, and relax. One more time, other side, all the way back, all the way down, all the way across. And relax. Now we got to do something for our hips. Imagine that you have a little bowl of water in front of you and you dip your fingertips into the bowl and you have a little sprinkle of water on your fingertips and you're going to sprinkle water on your friend or your buddy or somebody whose attention you want to get or somebody you want to irritate. We're going to do the same thing with our feet. So we're going to slide a little bit away from our desk so that there's room. And what I'm imagining is that I have a little bowl of water or a soup pot in front of me. And I'm picking my leg up and I'm going to put my right foot down. I'm putting my right foot down into my imaginary soup pot. Then I'm going to pull my leg out and I'm going to bring it around. My right leg is going to come to my right. And I'm going to give a little kick out to extend my leg. And I'm going to bring it back into my pot. I'm lifting it up. So I'm putting my foot on the floor into this little pot. I'm picking it up and I'm just giving it a little kick. And while I'm sitting here, all that movement is going to come from your hip. Your hip is going to be defined as the joint where your thigh bone, the femur, has articulation and interfaces with your pelvis. So the hip is a ball and socket. It has a lot of degrees in motion, and we don't want it to get stuck in any of them. So we're picking our leg up, bringing it out, and giving a little kick to sprinkle those few drops of water away. And then we're going to do the same thing on our left side. So we're up, put your foot in the soup pot, bring it out to your side, and a little bit of a kick. Into the pot, up, out to your side, and a little bit of a kick into your soup pot. Now that we are talking about bringing our feet into this imaginary pool of water, one of the very important points that I have to make is we all have to drink more water. Anytime you get up and you go to the kitchen or you go to wherever you're storing your water in the refrigerator, don't allow yourself to become dehydrated. It can happen whether you're out exercising or whether you're home at your workstation. Please make sure that you're drinking enough water, breathing deeply, doing the little calisthenic type of body exercises that we've talked about, which I believe will all be stored in the lecture on our Facebook page. Sitting with 90 degrees everywhere you have a bend in your chair, and keeping yourselves as healthy and safe as possible. So
yeah, that last recommendation was my favorite. Always staying hydrated. I always have my water with me, but these were some great tips.
Thank you.
Covering just about everything. You know, you got the hips, the shoulders, the chin and the neck and everything, and your physical workspace. So these are great tips. This was a lot of information. Like you said, if people want to come back, they can scroll through the page and read up some more. And if you have any other tips, Dr. O, you could leave them in the comments, but we're running out of time here. We have Jeff coming up next with Tracy, talking about some more pain. This might be more internal pain, but we'll wait and see what he has for us. So thanks for your time today, Dr. O.
And thank you for keeping the moderation going and keeping everybody enthusiastic. And thank you all for tuning in. Bye.
We'll see you.